Team of correspondents spread out across those hot spots. We're going to start with NBC's Sam Brock. He's in Houston. It's one of the hardest hit cities in Texas. Hey, Sam, good morning.
Hoda Savannah, good morning. Houston is the epicenter of the illness here in Texas. Hospitals here are nearly at capacity. Intensive care units are overflowing with patients. And this didn't develop in the last couple of months. It developed in the last couple of weeks. It's a Texas-sized crisis. Coronavirus cases swelling in the Lone Star State. Governor Greg Abbott sounding the alarm as infections skyrocket.
If you do not need to be out, if you don't need to go to work, then stay at home.
More than 2,200 people have now died here, with total cases of COVID-19 north of 125,000. Houston's mayor threatening to temporarily pull licenses of businesses allowing too many customers or not enforcing mask requirements.
We want to really crack down on people who are not adhering to the rules.
Houston's Texas Medical Center reports 97% of the area's current ICU beds are filled, nearly 3 out of 10 with COVID patients. Dr. Neil Gandhi oversees more than a dozen emergency facilities for Houston Methodist, one of the area's largest healthcare providers, where the number of coronavirus patients has tripled since Memorial Day. For those of us who are not on the front lines and not in the hospital every day, how bad is it in Houston?
I think over the past 7 days, things have significantly crescendoed, and there's been a massive uptick in cases.
Further west in Hays County, Texans aged 20 to 29 make up more than half the positive cases. That includes Texas State University student Adriana Carter, who recently tested positive after a night out on the town.
I wanted to go out and have some fun with my friends, and that's exactly what I did. There's consequences to your actions, and it just so happened that I got corona, and now I'm suffering those consequences.
The community suffering as well, with infection rates continuing to rise dramatically.
The numbers are very concerning, and we need to do something because we're really running up close to being at a capacity/crisis situation.
And I'm here at the Texas Medical Center, where the modeling for the area is even worse. For the next 2 weeks, bed capacity is expected to hit unsustainable levels. Now, Dr. Gandhi also told me that field hospitals and tents are a possibility if things don't improve soon. Savannah?
All right, Sam Brock in Texas for us, and let's move now to Arizona, also dealing with a dramatic spike. NBC's Joe Fryer is there. He's in Scottsdale with more on the dire situation facing hospitals in Arizona. Joe, good morning.
Savannah, good morning. The county where I'm standing, Maricopa County, has seen over a third of its cases in just the past week. Hospital beds are filling up too, raising alarms across the state, and Arizona is far from alone. Across the Sunbelt, states are shattering records, from Florida with more than 5,000 new cases in a single day to California with over 7,000 in a day. Disneyland's reopening is now delayed. Not even the scorching sun or 110-degree desert heat can slow the virus in Arizona as hospitalizations soar.
I was not social distancing, not wearing a mask, and kind of just felt invincible, right? So.
Jimmy Flores was hospitalized with COVID-19 earlier this month. The 30-year-old thinks he got it at a bar.
I was worried about my grandparents and the older population, right? But for me, I didn't take it seriously for myself, which was a very terrible mistake.
With 88% of the state's ICU beds now full, health experts are worried.
All the indicators are really, really bad in Arizona.
That includes Will Humble, former director of Arizona's Department of Health Services.
And the time to staff up isn't when you already have beds in the hall. The time to staff up is now so that you can prepare for when that happens.
Surging cases are a daunting obstacle for businesses that have reopened, or in some cases, just opened.
To me, this COVID thing could be life or death for certain people. And I'm going to do the best I can with what we have, with what knowledge we have.
Rashida White and her husband were initially planning to launch their newest restaurant, Brunch and Sip, in March. Instead, they opened in May with masks and social distancing, which limits capacity to around 40%.
I worry about if, I bring something home to my husband and we go down, we're the owner of these businesses. We are the front line, but I can't stay at home and expect my employees to be here on the front line without supporting them.
White does own other restaurants that do takeout, so those businesses are faring better during the pandemic. One of her biggest challenges, she says, is dealing with customers who don't want to wear masks. Hoda?
All right, Joe, thank you. Now to another one of the newest hotspots. We're talking about Florida, and that's where we find NBC's Carrie Sanders. Hey, Carrie.
Good morning, Hoda. Florida with a record 5,511 positive coronavirus tests in a single day. Now, while most of the people who have been dying from coronavirus have been age 65 or older, younger people, many who feel that they're indifferent to the virus, are now finding themselves sick and going to the hospital. 15% of all of the state's coronavirus-related hospitalizations have now come from people aged 25 to 44. That Florida Health Department statistic coming on word now that a second teenager in Florida has died from COVID-19.
So, what we're seeing in Florida is really rapid transmission in that 18 to 34 age group.
Residents in Alabama, Arkansas, Arizona, here in Florida, North Carolina, South Carolina, Utah, and Texas are now being told that if they travel to New York, New Jersey, or Connecticut, that they should self-quarantine for 14 days. As we all know, the epicenter had been in that tri-state area, and the concern now is that people in the South and Southwest will travel into the New York region and cause the problem to resume all over again. Savannah?
All right, Carrie, I'm a little worried about your voice. I have a little hot tea this morning, okay? Take care of yourself. We'll turn to Dr. Ashish Jha. He's the director of the Harvard Global Health Institute. Dr. Jha, good morning to you. We see this headline. It's a jarring one that the U.S. sets its highest record ever of single-day new cases of coronavirus. How alarming is this to you?
So good morning. Thanks for having me on. It is pretty alarming. It's pretty worrisome. Obviously, we had hoped that we would be able to keep the virus at bay for a while, but we're seeing these resurgences largely because we opened up too quickly and we opened up without the right safeguards in place. And I'm worried that we're going to see continuing increases in number of cases in the days and weeks ahead unless we really take much more significant action.
Yeah, and I'm sure you feel like a broken record on this, but I think it really bears underscoring. A lot of folks are probably sitting there going, okay, we have this 46,000 number of cases. Sounds terrible, is terrible, but we are testing more. And many of those cases we now know are young people who don't get as sick. So is that needed context right now? How do you see it?
And so context is always important. And what we know is the following. First of all, we have very good evidence that this is not just about more testing. Hospitalizations are going up. And we are clearly identifying more infections and more people are getting infected. So it's not just about more testing. In terms of young people, I have two comments. First is we know young people can get pretty sick as well. We just heard about the teenager who died. We don't know the long-term effects of this disease, but more and more evidence suggests that there may be real consequences. And then, of course, young people don't just stay among young people. They go spend time with their parents and grandparents and get other people sick. So I unfortunately just don't take a lot of comfort in those two pieces of data. I'm still pretty worried about where the trend is heading.
Well, and let's look at these hotspots. You've got Texas, California, Arizona, Florida. They feel like they're at a tipping point. What needs to be done right now to stop this wildfire from getting really out of control?
Yeah, I think wildfire is a good analogy here. And what needs to happen in my mind, a few things need to happen immediately. I do think those states need a public mask law that says you cannot go out in the public. You can't go into restaurants or public spaces without a mask. That's minimum. Second, I think all large gatherings, nightclubs are still open in places. Restaurants are open. I really think the state has to look at whether it can sustain having indoor restaurants at all. And then the thing that we've been talking about, all the public health people have been talking about, is these states have to put even more effort on testing and tracing, not just to find more cases, but to isolate people as soon as they're found to be infected so they don't infect other people. That's the strategy we have, and we've got to implement it right away.
I was going to say, it's a critical moment. Dr. Jha, thank you as always for your perspective. It's 12 minutes after the hour. Hoda, I send it to you.